Tonight in COVID Conversations, we focus on the new challenges of healthcare workers as this pandemic worsens. Hospitals are flooded with coronavirus patients and with more illnesses now from the Thanksgiving holiday. And the situation is only expected to get worse. Earlier today, I talked to Deborah Burger. She's a registered nurse in Sonoma County. She's also president of National Nurses United. And I asked her what it was like working in a hospital right now.
It's extremely frustrating and scary at the same time because we still don't have adequate PPE. We have, in some areas, more patients than we can safely provide care for. And because of the Thanksgiving holiday, there's more surge in the COVID epidemic. And we already know, for instance, at UC Davis, at Thanksgiving, they had 35 patients, and today they have 68. So it's putting a strain on nurses, in addition to the fact that they have 145 staff that are infected as well. So it's extremely concerning, not only in California and the Bay Area, but nationwide. I really am very proud of the fact that nurses and other healthcare workers have managed to come through and take care of people, but they're putting a lot of strain on healthcare workers. We're human beings just like everybody else, but with these surges that are happening, it's becoming unmanageable, and nurses are suffering moral distress because they know what they should be doing and they're not able to do everything they can.
And there's also been a question among nurses about testing, but soon they will be able to get tested more often. Starting on December 14th, hospitals will be required to test their healthcare workers at least once a week. Burger welcomes this testing program and told me it's long overdue.
Initially, they said that there was a shortage of testing, and so they were going to use it on an as-needed basis. But in the end, it was football players could get tested every day. We had many politicians that were getting tested every day. We've had all of this happening, yet the healthcare workers that are working with patients couldn't get testing. So we're extremely pleased that our work lobbying to get testing is finally happening.
As we mentioned earlier tonight, a CDC advisory panel recommending earlier today that some healthcare workers be the first group of people to get a COVID-19 vaccine. But Burger says that more evidence is needed before she and her colleagues commit to getting a vaccine.
We're really excited that there may be a light at the end of the tunnel, but nurses are scientists and we want to see the data first. We want to make sure that they're safe, because if we take the virus and there are severe side effects that we're unaware of, we could end up putting more healthcare workers out ill than and end up being shorter than we already are. So seeing the data will help us understand what our options are.
Now, to flatten the curve and to keep COVID patients out of hospitals, Burger also urged the public to listen to health officials, to wear your mask, wash your hands, and stay at home if you can.